Hi, I'm Dr. Dan Rubin. I'm here at the 2020 annual convention of the Oncology Association of Naturopathic Physicians in Scottsdale, Arizona. I'm sitting with my good friend and longtime colleague, Dr. Gurdev Parmar, the editor-in-chief of the brand new, newly launched, and launching now, Textbook of Naturopathic Oncology. This book marks a huge leap higher for the profession of naturopathic and integrative oncology. So many congratulations on your publication and your work.
Thanks so much, my
Let's
friend.
see the book.
There it is.
Wonderful. Tell us about it. Tell us about, what was your journey like? When did you start conceiving of developing this work?
So I took a sabbatical in 2014, started June 1st, 2014, and I needed a little break from practice, and my intention was to write a book. At the moment, I thought I was going to be able to finish the book within the 6 months of my sabbatical.
Oh my God.
And now, 5.5 years later, it's finally complete, and has contributions from about 40 of our colleagues. Now, after publishing, how to get the word out.
What's the intent of the book? Who is this book pointed towards? Who are the users of this book?
So I've personally been using the book in my office for the past month. So I think any clinician, any naturopathic doctor, naturopathic oncologist, integrative practitioners of every stripe that treat people living with cancer, and then, of course, most importantly, perhaps to me, is the people living with cancer, the patients. I think this is going to be like a roadmap and a singular source of information that has over 2,800 references in it.
Wow.
And brings people up to the state of the science as we know it today.
You know, we've often talked in naturopathic medicine about precepts of treatment and our modalities and our virtues and the 6 precepts of naturopathic medicine, and it's often been talked about that communication is also a mode of treatment. And it sounds like being able to have this within the hands of the people, or the people who have family members with cancer, that they'll be able to communicate maybe even more effectively, or even at a higher level with their physicians, because they'll have this material, the references, they'll be able to ask questions. And it seems like a valuable tool for both clinician and for non-clinician.
I completely agree, Dan. I think this is going to help inform not just practitioners, but the patients, and that information is going to help have conversations that are meaningful for both parties.
Can we see the cover again?
Yeah.
Tell us what's on the cover.
Okay, so this was a really fun process. You can see in the background that the background image is of dendritic cells attacking cancer cells.
So dendritic cells are very specialized immune cells.
Correct.
Okay.
Yeah, that's right. So immune cells attacking cancer cells is the background of the textbook. And then this image here is of Coriolis versicolor, or turkey tail mushroom.
Which is, what does turkey tail do in cancer care?
So it's one of the agents that has the best data for improving survival in various different types of cancer, and it's mainly for the immune system. So
you've got the immune system attacking cancer, and you've got fuel for the immune system.
That's right.
To fuel those dendritic cells.
Yes, and then, as you know, my dear friend, here we have a little IV set to indicate some of the newer technologies that are being used by naturopathic doctors or integrative clinicians. And then, you know, had to put a little picture of a mortar and pestle in there to bring in the old school of naturopathic
Because
medicine.
we still do that.
Of course,
I mean,
it's
still
a critical part of our job.
Wonderful.
And I think we're blessed. We get to be shepherds of what humanity has gathered as information for our existence on Earth, and then combine it with science.
There's a real revolution in oncology care. You put it in a book for all of us to use on our desktop every day. Thank you.
Thanks, Dan.
Thanks.